Opioids are drugs that include illegal and legal use. Illegal use, such as heroin and synthetic opioids, include fentanyl, and legal are prescription drugs such as oxycodone, hydrocodone, methadone, morphine, and many more. Prescription opioids are used to treat moderate to severe pain and are often prescribed following surgery or injuries. The problem is that overdose rate has been increasing since 1999. The number of overdose deaths involving opioids was 6 times higher in 2017 than in 1999. During the 1990s, the prevalent opioid overdose was prescription opioids. During the early 2000s, heroin overdose had increased, and now the prevalent overdose is fentanyl, which is 50 times stronger than heroin. It is reported that 1 in 4 patients receiving long-term opioid therapy struggle with addiction. Opioids are chemically related and interact with opioid receptors on nerve cells in the body and brain. Opioid pain relievers are generally safe when taken for a short time and prescribed by a doctor. But because they produce euphoria in addition to pain relief, they can be misused by taken in a different way or in a larger quantity than prescribed, or taken without a doctor's prescription. Regular use, even prescribed by a doctor, can lead to dependency and misuse. Opioids have effect on attitudes by causing low levels of testosterone, which causes low sex drive, energy, and strength. It also causes depression, poor decision making, and judgment to support their habit. Inhibition decreases, causing poor judgment, such as driving under the influence or having unprotected sex. It also has effects on behavior, such as relationships start to crumble due to the person focused on using opioids. The person is being sneaky and lying because they do not want others to know about them abusing opioids, and users may start to steal to support their drug habit. Misusing this drug leads to many consequences, with the main one dying of an overdose. For those taking opioids for pain, they can build tolerance and become addicted. It causes brain damage due to hypoxia, liver damage, and for those that are intravenous users, they can get HIV, AIDS, hepatitis B or C, and any other STI.
Risk factors of opioid includes past or current substance abuse, untreated psychiatric disorders, someone being younger age, social or family environments that encourage misuse, and middle-age comorbidities. Opioid misuse can be avoided. Protective factors include having a positive self-image, having self-control, having good social competence and parental involvement, having a long-acting opioid prescription so individual does not get refills early. Some protective factors in communities are available of faith-based resources, after-school activities. In order to combat issues of opioid misuse, a specific model that can be used is the trans-theoretical model. This specific model focuses on behavior change rather than one event. The model starts off with pre-contemplation. During this stage, the individual does not realize that taking opioids excessively will affect their health, in which they take no action to reduce their habits. The next stage is contemplation. The individual starts to see how opioid misuse starts to affect their lives and decides to make a change. The next stage is preparation. During this stage, the individual develops goals to reduce their opioid misuse intake. The next stage is action. Individuals start counseling or family therapy to help move forward with the efforts to stop their drug misuse of opioids. The next stage can be relapse. Although this stage may not always occur, behavioral interventions alone have poor outcomes, with more than 80% of patients returning to drug use. This is why it is important to have a strong support system. The final stage is maintenance. Individuals will continue to work hard as possible to refrain from opioid use. At this point, even moderate opioid use cannot be possible due to it being a possible trigger for misuse, which is why individuals find alternative for chronic pain such as physical therapy, acupuncture, surgery, injections on nerve blocks, over-the-counter medication. This concludes today's video. Thank you for watching.